Hello and welcome to Healthy Living. I'm Dr. Pelto. Welcome to episode 7 here of Healthy Living. We're going to go over a few things today, that some of the questions that we got in this last week. So let's get right into it. Here we go. A few things we saw, a fracture question, some nail fungus questions, a couple of other infections and ulcers that we saw this week. So let's get right into it. The first question is, I had a great toe fracture on 5/28/20, which is about 2 weeks ago. And the first doctor gave me a lower leg heavy cast. And then I showed another orthopedic doctor that gave me buddy plaster. What buddy plaster probably means is taping the toes together. Okay. Give me any precautions. So when we talk about great toe fractures, it really depends on what type of a fracture. So let's talk about a couple of types. There are avulsion or fractures that involve the joint. Fracture that here involves the joint, and another fracture that involves the joint. Those tend to be worse. What buddy taping does, or buddy splinting, is you splint one toe to the other toe. That can be helpful sometimes. Normally we put them into some type of a walking boot. We don't use many hard casts here in the States, but some people still use hard casts. But you would basically reduce your activity. The more activity you have over an area where there's a joint, the longer it's going to take to heal. A typical fracture takes 6 to 8 weeks. There is some research that shows that bone stimulation or shockwave therapy can help speed that up. But basically, you need to wait for 2 months for the fracture to heal. But if you do a lot of activity, it can take longer. It can turn into a non-union or other issues. But really, 2 weeks into it, it's way too soon. And the swelling will come down after it's healed. So I hope that answers your question. A patient with a toenail fungus question. This patient, we took a nail sample. It did show nail fungus. How do we treat this? Well, there's a couple of options. One option is to trim back to where it's attached and help it to clear out the fungus, like avulsing or removing that portion of the nail. You can try some topicals. I don't find topicals all that effective. You can try laser treatments. Sometimes that can be effective, as well as the oral antifungals. But really, I wanted to show here, sometimes we do trim that area out for patients. Another patient that had an infection here, you can see the redness. That's the difference. There's no redness here, okay? This one here, she has a fungal infection. She has been treated before, but she has an infection here at the nail base. The issue is, if an infection only involves one part of the side, you can take out a side, but when it involves everything, and this was very loose, I had to pull off that whole toenail. That's what we do. Normally we don't do antibiotics. We'll mark the line where there's redness, and if it doesn't get better, she will call in and call in for an antibiotic. People ask, what does it look like after having wart therapy? So this is an example of what happens with the blistering of cantharidin. So this patient had some cantharidin treatment applied, and that's used to treat warts. I'm going to put some other videos underneath at the description about cantharidin or wart treatments and fungal toenail treatments. You can find that all in the description of the video. So here's a patient with an ulcer. So when we talk about ulcers, this patient was kind of a complex patient. You can see the swelling in the foot. You can see the ulcer down here. It has a fibrotic base, but you need to have treatment of that ulcer. There's a lot of different treatments, however you want to, but basically you have to stay off the foot and then do some type of a wound dressing on there. I'll put a little link to one of the booklets that I put together that you can get more information on wounds if you'd like. And then this is an interesting question. This patient had a matrixectomy, which is basically where a nail edge is killed permanently. And this nail edge isn't going to come back, but what we see now is a little cracking of the nail. That's pretty common, actually, that crack. And because it happened, let's say 2 months ago was the procedure, and it kind of causes a little crack at that time. This nail can be trimmed if it's painful, but it will grow out and grow out reattached without that line. The line was from the procedure. And then finally, kind of the worst thing of the week, this is a patient that came in with a really kind of a bad foot with these wounds on the side. I know it's all swollen, and it was just too bad with COVID. This patient certainly has significant neuropathy. They can't feel it. And you can see here in the bone, there's actually some erosion of the bone here. That's called osteomyelitis. And this is going to be a difficult patient case. We'll have to take out some of the bone that's bad. It's really hard to treat that with antibiotics. And then finally, there is a patient that asked something. I don't know if you can see this ingrown toenail picture here, but this is a Portuguese question, and I'm going to answer this one in Portuguese at the end. Certainly, if you want to ask your own question, you can go to drpelto.com and ask a question, or you can just click this little link here. But this patient says, "Hello, doctor. I'm going to have tomorrow an ingrown toenail procedure. I go to see the pedicurist or podiatrist or podologo every 3 months. And will this help me so it doesn't come back when it heals? Will it make my nail normal?" That's the question. If you are having to see someone every 3 months, and this is what we're seeing this time of the year, is people go to the nail salon, and because of COVID, they haven't been able to go, so they're coming in to see us with these ingrown toenails. If you take a portion of the nail out and put the medicine in there, either a chemical or you do it sharply, it's not going to come back in the edge anymore. That's the goal. Occasionally it can, because you try to put all those, get all those cells with that Q-tip that you put in there with either the phenol or the sodium hydroxide, and normally it doesn't come back. That's what we're going to try to do. That's what they're going to try to do, hopefully. If they can't do that procedure, then it will come back. And then taking out you can see on this picture here, taking out the edge of the nail, that stuff that's in there, that needs to be taken out. Okay. Well, those are the kind of the things that we went through, the questions we got this week. If you have your own question, please ask it at drpelto.com. Thanks.